This is a small introduction to role plays. Many medical schools use role plays to test communication skills. For example, breaking bad news, counselling, explaining information, or dealing with difficult patients. So what are some important aspects of communication? Well, first of all, you should show empathy. You should be clear and concise. You should show an understanding of the situation. You should use active listening. So what we mean by active listening is making sure that we are nodding our head, we're keeping good eye contact, and we're really engaging in what someone is talking about. And finally, we should use a combination of good verbal and non-verbal communication. So whether that be your posture or using your hands as well. So here are my top tips for roleplay stations. My first tip is to use your reading time well. This is so important because sometimes you get 1 minute or 2 minutes to have a read of a question or what you'll actually have to do in this station. Try not to blank out. Try to read words that are very important and then understand that by the end of this station, you need to have completed a task. So for example, if you need to break bad news to someone in a station, make sure that by the end of the station, you have actually given the news to someone else. My next tip is about how you actually walk into the role play. You should walk in with a sense of confidence, but also with a neutral expression. Don't be smiling if you're about to break bad news. This posture, this character that you display when you come into the room or to the area that you're doing your MMI station should really show that sense of confidence to the interviewer and also the actor. This applies exactly the same with online interviews. You should show that sense of character, you should show that sense of enthusiasm, but also make sure that you understand that you're taking this seriously as well. The next thing to remember is to introduce yourself. Maybe introduce your name to the patient or to the actor, or maybe ask them for their name as well. So for example, in maybe a clinical situation, confirm the patient's age and their name and their date of birth perhaps. This way, you're actually building a bond between yourself and the actor or the interviewer. My next tip is all about eye contact. Try to keep engaged with the actor and the interviewer. Make sure you're looking up all the time, you're using that active listening skills, but also try not to droop your head down or look away from the scenario, because that way you're not going to look engaged. So I've kind of touched upon this point already, but I feel like you should be acknowledging both the actor and also the examiner as well. Even just by looking at the examiner, maybe smiling at them, will actually build a sense of rapport between yourself and that interviewer. Again, this really does depend on the station. Sometimes the interviewer is the actor, or sometimes the interviewer is kind of hiding on the side of a room. It might seem really obvious, but try to act as professionally as possible. Imagine yourself as a medical student, a doctor, or the specific player in that scenario. This is one of my most important tips. It's all about smiling. If you don't smile during your interview, you aren't showing that you're enjoying it or being enthusiastic or actually showing that sense of confidence. So smiling equals confidence, which also equals enthusiasm. So try to smile as much as possible, because that way the interviewer will realize that you're actually enjoying this situation and actually you're going to become, or you would like to become, a medical student. Obviously, this is very situation dependent, so if you need to break bad news, you shouldn't be grinning the whole time. You should just try to stay and keep that neutral face. My final tip, and probably the most important tip, is actually by start opening up and then close. So what do I mean by this? Well, what I mean is that at the beginning you should be asking as many open questions as possible. So one way, or one really nice technique that you could use is thinking about who, what, where, when, why, how. If you use these techniques, then actually you'll be asking opening questions like, how do you feel? Or what are your concerns? And once you've got the actor or the interviewer to actually talk a bit more about their concerns or worries, then actually you can start asking more specific closed questions, which usually end up as a yes or no answer. So those are my top tips. In the future, we're going to go through some more examples with real candidates and real scenarios. Do you have an interview for medicine, dentistry, or veterinary school? The interview is the final hurdle of your application, but also the most competitive. Are you nervous about your interview or unsure where to start preparation? Here's where we can help. With a few clicks, you'll get access to 100 Medic Mind video tutorials covering 10 hours of theory, 150 MMI stations, live weekly webinars, and more. You'll get a breakdown of all the topics interviews typically cover, and real-life MMI stations. Our award-winning interview course is trusted by over 12,000 students in over 37 countries and has been written by official medical school examiners. So, what are you waiting for? Get started on our course today.